Good morning. My name is Dr. Jasmine Patel. I am an obstetrician and gynecologist and family planning specialist who works at the University of California, Irvine. I'm excited to talk to you today about female birth control, Part 1, the menstrual cycle and natural family planning. This presentation is part of a series of presentations on reproductive health issues on the ReproNet channel. Subscribe at the link below in order to learn more. Let's start off by understanding your menstrual cycle. We will then talk about the different natural birth control options. Lastly, we will review normal versus abnormal for your reproductive health. To review your normal reproductive life cycle, most girls get their first period after their bodies have matured with breast buds and pubic hair around the age of 12 to 13. Menstrual cycles starting off are often irregular and take a few years to become monthly. If your daughter is having heavy bleeding or her periods keep her from school, she should see a healthcare provider to discuss medical options to make them more normal. Your menstrual cycle continues throughout your life and means that you are fertile and can get pregnant. If you are not using any birth control, having a period every month is normal. Skipping periods or not getting a period is abnormal. Talk to your healthcare provider if this is happening to you. As you get older and into your 40s, your period will start becoming irregular, and that is normal. You may also start experiencing hot flashes, vaginal dryness, and mood changes. If you are still getting your period even though it is irregular, this means you are in perimenopause. You can still get pregnant, but it is very rare. Your healthcare provider can help you if you are bothered by the bleeding or hot flash symptoms. After your period stops for a whole year without being on birth control, you are in menopause. This means you can no longer get pregnant. You may have hot flashes, vaginal dryness, or mood changes. If these symptoms are bothering you, talk to your healthcare provider. This usually happens in your late 40s and 50s. If you do not have bleeding from your vagina during menopause, that is normal. However, if you do have bleeding from your vagina during menopause, that is abnormal, and you should see a healthcare provider. Let's now go in depth to talk about the menstrual cycle and what is happening in your body during it. The menstrual cycle starts on the first day of your period with full blood flow, not spotting, and ends on the day before you get your next period with full flow. On average, this full cycle from one period to the next is about 28 days, but can be as short as 21 days, 3 weeks, and as long as 35 days, 5 weeks. Each cycle has a different amount of days, usually, and that is normal. During the first part of your cycle, you have your period. Your period can last between 2 to 7 days, which is normal. More than that is abnormal. Having some pain in your back or belly can be normal and should be relieved by ibuprofen. If your period is heavy or painful and not relieved by medicine, you should talk to your healthcare provider. During your period, there is no chance of getting pregnant. During the second part of your cycle, you do not have any bleeding. During this time, the lining of your uterus is starting to build up and your brain is telling your ovary to mature your eggs. There is a low chance of pregnancy during this time, but it is still possible to get pregnant. During the third part of the cycle, you can get pregnant if you have sex. This is because an egg comes out of the ovary and waits for a sperm to fertilize it. This is called ovulation. You can also get pregnant if you have sex before ovulation because the sperm will wait for the egg. Your vaginal discharge becomes more at this time as your body wants you to have sex and get pregnant. When you want to become pregnant, you should start taking a prenatal vitamin for a few months before you start trying for pregnancy. Having sex during ovulation gives you the best chance of becoming pregnant. Make sure to review your medications with your doctor prior and eat healthy food and exercise to have a healthy pregnancy. If you do not become pregnant and the egg is not fertilized, you experience the last part of the menstrual cycle. The egg dies, so there is a very low chance of pregnancy. During this time, the lining of your uterus is getting ready to be shed during your next period, but you do not have bleeding yet. Your vaginal discharge should go back to being thicker and less during this time. You may experience some bloating, headaches, or low back pain before your period. If this is bothersome, talk to your healthcare provider. Understanding your normal menstrual cycle can help you understand how birth control works. Any questions before we proceed? When you do not want pregnancy, there are many different types of options for birth control. They require a different amount of work on your part or for your partner. There are natural methods, non-hormonal methods, and two different kinds of hormonal methods. Let's first talk about the natural methods. Natural options, or cycle beads. The method at tracking where you are in your cycle is good for women who have periods that are 26 to 32 days apart from the start of one period to the start of another. The red bead is for day 1 of your cycle, the first day of any bleeding. There are 6 brown beads that follow the red bead. These are for the days you are bleeding. They are brown because the risk or chance of pregnancy is very low during this time. So this is not a great time to have sexual intercourse if you're trying to get pregnant, but it's an okay time to have sexual intercourse if you are not trying to get pregnant. The first white bead is the first day of no bleeding after your period. This is the start of when an egg matures in your ovary and will be released. Again, the release or ovulation is around day 14 of your cycle if you have 28-day cycles. So this is a good time to have sexual intercourse if you're trying to get pregnant, but it's not a good time to have sexual intercourse if you're not trying to get pregnant. These are the days to avoid sexual intercourse if you do not want to be pregnant or to use another method of birth control. The brown beads after the white beads are the days after you have ovulated, released the egg from your ovary, and the egg has gone away and you have not become pregnant. You haven't started your period yet. The number of beads in this section may be different for people with longer or shorter menstrual cycles. Again, they are brown because the chance of pregnancy is very low at this time. So this is not a great time to have sexual intercourse if you're trying to get pregnant, but it's an okay time to have intercourse if you're not trying to get pregnant. To know where you are in your cycle, you move this black rubber band from bead to bead, starting on the first day of your period on the red bead. Another way to see where you are in your cycle is to watch your temperature every day throughout your cycle. This can be helpful if your periods come at different times every month or every few months. Right after ovulation, your body temperature goes up about 0.5 degrees Celsius or 1 degree Fahrenheit. However, this is a difficult method to use to prevent pregnancy as you don't know that you have ovulated until after it happens and there could be sperm waiting for that egg. Another way to see where you are in your cycle is to watch what the discharge or mucus from your vagina looks like. This can be helpful if your periods come at different times every month or every few months. During your period, you may not have much discharge or mucus, and it might be white, cloudy, making sticky lumps. After your period, the discharge or mucus is still typically creamy or cloudy looking, thick but not as sticky. As you get closer to ovulation, the discharge becomes more clear and slippery, like an egg yolk. It acts like an elastic band between your fingers. This is when you can mostly get pregnant. Another way is lactation suppression of ovulation. Lactation means breastfeeding, and amenorrhea means no bleeding. Breastfeeding as birth control works for women who are exclusively breastfeeding every 2 to 3 hours, day and night, and do not get their periods in the first 6 months after having a baby. You need all 3 things for it to work: no period, only breastfeeding, and having a baby that is less than 6 months old. Let's go over some abnormal versus normal symptoms now. It is normal to have cramping, swollen breasts, and mood changes before your period. However, having spotting, nausea, or darkening of the nipple can indicate that you may be pregnant. If you're ever concerned about being pregnant, make sure to take a pregnancy test from the pharmacy. If your vaginal discharge becomes thick and your vagina becomes itchy, or if your discharge has a fishy smell to it, you might have an infection. You should go see your healthcare provider to be examined. This is not normal. Let's test our knowledge now. Is discharge that changes throughout the month but has no smell normal or abnormal? We would say that this is normal. What about discharge that is itchy or has a fishy smell? That would be abnormal. What about spotting in between your periods if you are not on birth control? That would also be abnormal. Bleeding after menopause? Abnormal. Periods that last for 14 days when not on birth control? Also abnormal. Please talk to your healthcare provider about these things. When can you get pregnant during a menstrual cycle? When the egg comes out, or ovulation. Please address any comments. The ReproNet program lead. Here are some useful resources for you to contact. Thank you very much for listening.